Hi, my name is Garrett Strop. I'm the owner of OrMobility here in Roseburg. And today I have Rachel Galligan with us, our nurse coach, and she's going to be talking about diabetes, metabolic syndromes, and glucose concerns. So thanks, Rachel, for being here. And let's just get kind of right into it. So when a client with diabetes or metabolic syndrome comes to you first, what are some of the most common concerns or challenges they share?
Sure. Thanks, Garrett. One of the biggest things that I hear from clients, especially when they're newly diagnosed with diabetes or metabolic syndrome, is just how overwhelming it can all feel. There's a lot of mixture of fear and frustration and just a lot of confusion. I have clients that say, I have no idea where to start, or I've just read so much conflicting advice that's huge. And then they'll just feel, paralyzed, like they just don't know what to do. So I aim to approach these types of concerns and challenges first. We might explore that overwhelm and break down information into bite-sized morsels that feels just really doable to them. Or we may pay attention to that feeling of confusion and focus on education first in a calm and a non-rush environment. There's an opportunity to create a foundation on which these new lifestyle habits that we're going to talk about can be built. And that foundation, when it's constructed on confusion or fear or overwhelm, it's just not going to hold or support the new habits that could really make a difference in managing diabetes or other metabolic disorders. So, for example, I'm working with a woman in her mid 50s who recently just had her labs drawn. And she came and she sat down in my office and she said, well, they said I'm pre-diabetic. And she had, really little idea of what that meant, and even less of an idea about her treatment options. She actually recalled it being, she used all a blur, that phrasing, when she tried to remember what her provider had even talked with her about. Those were her concerns and her challenges. So we take the time to address those things first because it helped her to feel empowered to be able to make that first little behavior change. And it opened her eyes to all of the options available for her.
Yeah, it's always amazing when you can kind of see that spark in a person's eyes, like they really understand and it makes sense and they kind of have these like actionable ideas of what to do next. Sounds amazing. So, can you walk us through what a typical session might look like when you're working with someone concerned about glucose levels?
Sure. So a typical session is, again, really centered around the client. It's not a one size fits all approach. So when somebody comes in with concerns about their blood sugar, or they've recently gotten a diagnosis like pre-diabetes or a full-blown type 2 diabetes diagnosis, we start by just having an open conversation. It's not one of these cases where I'm saying, yes, no, do you do this? Do we do this? What have you done? I want to understand their whole story. What's been going on in their life? What have they tried before? What's worked and what hasn't? And then, importantly, how are they feeling about all of that? From there, we start to explore what is most important to them. So some clients are super focused on nutrition, while others are more concerned with energy levels or their perception of their stress levels or how they're sleeping. So we really build from their priorities and not mine, and not based on that diagnosis that they heard, right? We might talk about things like meal timing or how certain foods make them feel or how they're sleeping, but it's always collaborative. And we also check in on mindset too, because managing glucose levels isn't just physical, it's emotional and mental too. By the end of the session, we've usually co-created a few small goals or experiments that they're curious about trying, and then we plan for how we're going to check in on those at the next visit. It's very much a partnership. I'm really not there to tell them what to do. I'm there to support them in discovering what actually works for them and then use it out in real life.
Amazing. So, do you collaborate with other healthcare professionals like an endocrinologist, dietitians, or physical therapists? And if so, how does that collaboration enhance client outcomes?
Oh, absolutely. Collaboration is a huge part of what I do as a nurse coach. So while I support the lifestyle and behavior change sides of things, I'm always looking at the bigger picture. So when a client is working with an endocrinologist or a primary care provider or a dietitian, I see my role as helping connect those dots between their clinical care and then their day-to-day life. For example, a doctor might say, you need to lower your A1C levels, or you should be exercising more. And the client often leaves thinking, okay, that sounds great, but how do I do that? That's where I come in. I help them take that medical advice and turn it into something that's realistic and sustainable, and it works for them. So it's easy to incorporate into their real life. I also work closely with physical therapists, like at OrMobility, where I'm part of this team, especially when clients are trying to build a movement routine, but are dealing with pain or mobility challenges. It's a powerful partnership. And I've seen clients feel way more confident when they know that all their providers are on the same page and cheering them on from different angles. When we all collaborate with the client included, it creates this really supportive network where everyone's expertise is valued. And that's when real lasting change can begin to happen. And we see it, and it's awesome.
Yeah, we sure see that every day, don't we? So, what mindset shifts have you seen make the biggest difference for people managing diabetes or metabolic syndromes?
I love these. I love to see those mindset shifts. And so seeing them happen is just so amazing to witness. And it shows me that a client is beginning to think creatively. They're starting to build trust in themselves, and they're just starting to see this real potential and their ability to be a key player in their wellness journey. And so I just get really excited about seeing that happen. One of the most impactful mindset shifts that I see is helping clients move out of that black and white thinking. This idea that choices are either perfect or total failure. So for a lot of people managing diabetes or metabolic syndrome, that kind of thinking can be paralyzing. It's like if they don't follow their plan exactly, they feel like they've blown it. And then they throw in the towel and they're back to square one. And that hurts. It hurts us as people to do that over and over and over again. It can be really damaging to a person's self esteem and the ability to trust in themselves. For example, I had a client who was really stuck in that mindset early on. She had been diagnosed with prediabetes and came to me after trying to follow a really strict handout that she had gotten online. It was very rigid, very, do this, not that. You've seen those books, right? Eat this, not that. Black and white thinking. Okay. So it felt manageable at home for her. And she actually had done a pretty good job of tailoring her diet when she was in that familiar environment. But the moment that she stepped into a social situation, she froze. So she told me about this party that she went to. There were snacks and desserts and casseroles, and nothing looked like anything that she had been told to eat. Nothing matched what she had in her perfect environment at home, right? So in the past, she would have said, just forget it and eaten everything, felt guilty, spiraled. But during one of our sessions, we had talked about learning how to live in that gray area, how it's not about perfection, it's about making the next best choice in the moment at a party, for example. So at that party, she knew she was going to go to. So we did all this brainstorming beforehand, right? Pause, took a breath. She decided to choose some protein from a charcuterie board and a few raw vegetables. And she had a small bite of the dessert that she had really wanted to try. She said that afterward, it felt so good not to panic or to give up. She relayed that she didn't follow the perfect plan, but she felt in control because she lived in that gray area. And that's the win right there. She used what she had learned, not a rigid rule, but this flexible mindset, and it completely changed her experience. So that shift away from black and white thinking and toward confidence in the gray area is what helps people actually live their lives while managing their health. It's not just about following this handout or this eat this, not that book. It's about building skills that you can then take and use anywhere.
Incredible, incredible. What are some of the small wins that tend to create big momentum for clients on this journey?
Small wins are everything. Honestly, they're the foundation of long term success, especially when it comes to managing something like diabetes or metabolic syndrome. So, a lot of people come in thinking that they need to overhaul their entire lifestyle overnight. But that mindset can be so overwhelming that they just never even get started. What I love to remind clients is that progress isn't about making one huge leap. It's about stacking those small wins, like placing one rock at a time to build a step to get over a wall, right? So imagine trying to move one giant boulder to get over this wall. It's heavy, it's intimidating, it's going to take a lot of practice to get it over there, and it's probably not going to move fast. But if you were to start gathering all those small little rocks, gravel, right, manageable size stones, like a short walk to the mailbox or adding a vegetable to one meal, incorporating maybe a meaningful or brief pause before eating, you start to build these real solid steps forward to be able to get over that wall, right? Those little rocks eventually become the path and then the step. So I had a client who just started with walking down the driveway to get the mail in the evening. That's it. It didn't feel like much at first. She was kind of chuckling actually when we were talking about it, right? but it gave her this sense of accomplishment. And that win made her want to do more, right? She actually comes back the next time and says, I'm ready for the next step. So a couple of weeks later, she started tracking how certain foods made her feel. And then she began feeling like maybe meal prepping just one lunch a week was doable. None of those steps felt massive, but all of them together, they created this huge momentum that built confidence and real change. And the best part is that each win made the next one feel more doable. It's this compounding effect, right? She went from I can't do this to I am doing this, one small rock at a time. And that's the power in nurse coaching. We don't wait around for a perfect moment to make one big change. We celebrate those small wins and use them to build something sustainable.
Incredible. So, what do you wish more people understood about diabetes, metabolic syndrome, or blood sugar regulation?
That's a great question. What I really wish people understood is that these diagnoses and conditions are not a life sentence. Yes, they're serious and they deserve attention, but they're also incredibly responsive to lifestyle change. So many people are told not what not to do, or they get this overwhelming diagnosis and they feel like their body is broken. And what's often missing from that conversation is the hope and the potential for change, right? So the truth is that things can change a lot. I've worked with clients who have reversed their prediabetes, they've lowered their A1C levels significantly, and they've reduced or even eliminated medications, under doctor's guidance. But most importantly, they start feeling better in their day-to-day lives. Energy improves, their sleep gets better, they feel more in control, experiencing all of these shifts in their global well-being. And it's expanding so far beyond just managing diabetes or blood sugar levels. And that's really powerful. And people feel that, these shifts don't come from crash diets or extreme routines. They come from sustainable, supportive changes. When you support the root causes, the body responds. We want to be in balance. I wish more people knew that it's not about discipline and shame and restriction. It's about learning what your body needs and honoring that. And there's so much potential for healing and change, no matter where you're starting from.
Well, amazing. Thanks so much for spending the time to talk to us more about this. How would someone get a hold of you?
Oh, so two ways. You can call our office, which is 541-845-3311, or you can hop on our website, ormobility.com, and navigate to the nurse coaching section. And then there'll be a link there where you can get in touch with me.
Awesome. Thank you.